Prevacid is the brand name for lansoprazole, an over-the-counter drug that is used to reduce acid production in our stomach. It belongs to a group of drugs called proton pump inhibitors. Prevacid is used to treat patients with gastroesophageal reflux disease, inflammation of the lining of the throat or stomach, or may be used with antibiotics to treat ulcers. It is also used for those who experience frequent heartburn 2 or more times a week.
How does Prevacid work? As a proton pump inhibitor, the goal is to reduce acid production in the stomach. We know the stomach provides an acidic environment necessary for digestion. However, overproduction of hydrochloric acid not only brings discomfort, but is harmful to the protective mucosal linings of the digestive tract. This includes the stomach and esophagus. The mechanism of Prevacid is to target the parietal cells, which are responsible for transportation of hydrogen ions into the stomach via the hydrogen potassium pump, also called a proton pump. Prevacid blocks this pump. What are some common side effects of Prevacid? You may experience diarrhea, stomach pain, nausea, constipation, headache, or low levels of magnesium. Stop usage of Prevacid and seek medical attention if you experience these severe symptoms: fast and uneven heart rate, severe allergic response such as a rash or face swelling, dizziness, confusion, chest pain, seizure, or sudden jerking muscle movements. How should I take Prevacid? If under the care of a doctor, be sure to take as directed. If using over the counter, be sure to read and follow product package instructions. Your doctor should be aware of all the medications you are currently taking as to avoid adverse drug interactions. Use of NSAIDs while taking Prevacid is also discouraged, as it promotes ulcer formation and increases GI bleeding. Prevacid should be taken in the morning on an empty stomach to provide the most optimal benefit. It may also take more than one dose to achieve its full effect. Contraindications or precautions for taking Prevacid include having severe liver disease, vitamin B12 deficiency, osteoporosis, or low levels of magnesium.
If you are pregnant, planning a pregnancy, or breastfeeding, tell your healthcare provider. It's not known if taking Prevacid is harmful to pregnant women or a breastfeeding baby. However, the FDA advises you should not take Prevacid while breastfeeding. Who will benefit from taking Prevacid? Those suffering from GERD, ulcers, or acid reflux. Signs of increased acid production that can lead to these conditions could be excessive belching, regurgitation, which is a sour taste in the mouth that creeps up in the throat, burning sensation in the chest, and blood in the stool associated to stomach pain.
What will be most helpful in preventing use of Prevacid? Lifestyle change is key. Eat smaller meals, don't lie down after eating, cut back intake of spicy or fatty foods and alcohol, weight loss, and cessation of smoking.
Frequent heartburn, which is a burning in the chest just below or behind the breastbone, occurs 2 or more days a week. It's not just uncomfortable, but it can interfere with your work, family life, and sleep. Here's how it can happen. Your stomach produces acid for digesting food. Sometimes the acid flows up into the esophagus, burns and irritates its lining. But there's something you can do about it. Prevacid 24-hour is an over-the-counter medicine to treat frequent heartburn for a full 24 hours. It's a proton pump inhibitor, or PPI, which means Prevacid 24-hour works by stopping the release of most acid into the stomach. Prevacid 24-hour prevents the production of acid that causes frequent heartburn for a full 24 hours, with 1 pill a day. May take 1 to 4 days for full effect, although some people get complete relief of symptoms within 24 hours. Use as directed for 14 days to treat frequent heartburn.
Oh, hey,
Hey, are you one of millions of Americans suffering from heartburn and pain associated with stomach ulcers? Well, not me. Because with Prevacid, I'm able to alleviate the pain associated with stomach ulcers and stomp out heartburn. And now you can too!
Prevacid is used to treat and prevent stomach and intestinal ulcers, erosive esophagitis, and other conditions involving excessive stomach acid. Over-the-counter Prevacid, OTC, is used to treat frequent heartburn that happens 2 or more days per week. Prevacid is not for immediate relief of heartburn symptoms. Do not use over-the-counter Prevacid OTC without the advice of a doctor if you have trouble or pain with swallowing, black or bloody stools, vomit that looks like blood or coffee grounds, heartburn that has lasted over 3 months. Side effects include nausea, stomach pain, diarrhea, constipation or headache, severe stomach pain, diarrhea that is bloody or watery, seizures, convulsions, kidney problems, urinating more or less than usual, bloody urine, swollen rapid gain, or symptoms of low magnesium, dizziness, fast or uneven heartburn, tremor, shaking, or jerking muscle movements, feeling jittery, muscle cramps, muscle spasm in your hands, and food popping or choky feeling. If you are pregnant, please consult your doctor whether it is safe or not for you to take Prevacid.
Oh, dang, I forgot the butter.
Lorelai has been working in a call center for 5 years. The volume of calls and the number of irate clients she receives every day are enough to stress her out. Even while she is at home, she still stresses out about her job and the kind of calls she would receive on the next shift. One night, while she is on the phone with a particularly angry customer, she started to feel a gnawing pain at her back. The burning sensation went on for days and is relieved after Lorelai ingests food. When she could not take the pain anymore, she consulted her physician.
Hi, I'd like to schedule an appointment with my doctor. For a few days, I've been having stomach problems, heartburn, and indigestion. Okay, thank you. Bye.
Yeah. Hi, Lorelai. I'm Dr. Richard. What brings you to my office today?
Hi, Dr. Richard. Well, I'm having this burning feeling in my chest and this sour taste in my mouth.
Okay, have you been taking any medication for this problem?
No, because I wasn't aware of which ones I could take.
Well, based on the symptoms that you gave me, it sounds like you're having a little bit of heartburn and indigestion. Do you consume a lot of alcohol or caffeine?
Well, this past week has been really stressful at work, so I've been drinking more caffeine than usual, and I've been having a glass of wine every day.
The pain of indigestion and heartburn is caused by too much acid in your stomach. Alcohol and caffeine can increase the amount of acid the stomach produces. So that may be a reason why you're feeling that burning in your chest.
Oh, so if I stop drinking the alcohol and caffeine, will that make it go away?
That will be a good start. You mentioned that you had a lot of stress at work lately. Feeling stressed or anxious can be a trigger for indigestion as well and even cause ulcer. So finding ways to relieve stress such as exercise will also benefit you. I'm also going to have you try an over-the-counter medication.
What types of medication?
I'm going to recommend trying lansoprazole, also called Prevacid. This drug decreases the amount of acid the stomach makes.
Okay, but does this medication have any side effects? Because in the past, medications don't always agree with me.
I'm glad you asked that, Lorelai. Prevacid is a very safe over-the-counter medication. Common side effects include headache, nausea, diarrhea, stomach pain, and constipation. What do you mean when you say medications don't always agree with you?
Well, generally in the past, when I took medication, it didn't always agree with me, including diarrhea and nausea.
Prevacid belongs to a group of medicines called proton pump inhibitors, which blocks the production of acid by the stomach. Prevacid works by lowering the amount of acid in your stomach.
Okay, when do you think I'll be feeling better?
Prevacid does not work immediately. It can take 3 or 4 days to see improvements in symptoms like heartburn.
Oh, okay. So how often do I need to take this?
Just be sure to read and follow the instructions on the box. Here is a brochure for you to read more and learn about Prevacid.
Thank you, Dr. Richardson. You were very helpful.
You're welcome. I hope you feel better soon.
Thank you.